Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Swelling is extremely common during pregnancy. Today we will be explaining everything you need to know about swelling during your pregnancy, how to treat it, and when you should be worried. So hit those like and subscribe buttons and stay with us. So swelling is the extra retention of fluid in your soft tissues. Specifically, it's usually mostly blood. This fluid actually serves a purpose during your pregnancy because it helps soften your joints and your tissues to get you ready to give birth to your baby. During your pregnancy, 50% more blood is produced, and 25% of your weight gain will actually be this fluid, which is also called edema. And edema can show up in your hands, your face, your legs, ankles, and feet. So swelling occurs because, like we said before, you produce more blood to help your baby grow. So as your uterus gets larger, it presses on a large vein inside your belly that helps take the blood from your legs to your heart. When this happens, the blood tends to pool down in your legs and feet, and this leaks into your soft tissue, causing swelling. As you go further along, this swelling can also occur in the upper body. There are several things that increase the chance that you're going to swell or swell more. Summertime heat is a big one. Additionally, standing for long periods of time or long days of activity can also increase your risk of swelling. So if you're planning on going on vacation, you need to take it easy. Diets that are low in potassium and high in sodium definitely increase your risk of swelling or edema. And you will want to avoid high amounts of caffeine because caffeine significantly increases your risk of swelling. Please remember to hit the like and subscribe buttons so you can get our latest content. From a dietary perspective, there are some things that you can change and do to help reduce your swelling. So start by eating a lot of whole, fresh foods. This is because salt is your enemy. You need to have less salt in your diet because that encourages you to retain water. So avoid lots of processed foods. In addition, salt reduces your potassium, and you need more potassium. So try to eat stuff like bananas, squash, spinach, avocado, sweet potato. You also want to reduce your caffeine intake. So if you really want to enjoy some, try to switch to lower caffeine drinks like tea. And finally, you want to drink more water. If your body thinks that you are dehydrated, it's going to hold on to a lot more water than you want. To avoid swelling, you need to avoid certain things. For starters, don't stand for long periods of time because gravity will work against you and it will help the blood pool in your legs and your feet. Avoid being outside for long periods of time when it's hot because heat increases your chance of swelling. You also want to avoid crossing your legs when you're sitting because this can inhibit the blood to return back to your heart and your lungs. And finally, make sure you rest when you can. Don't overdo things. What are some things you can do to help reduce your swelling? When you rest with your feet up. This will help with the swelling. Additionally, you want to swim or walk inside of a pool. This puts less pressure on your lower body. You can use cold compresses on your swollen areas, especially your feet. Not only does this reduce swelling, but it also feels fantastic. Sleep on your left side, which promotes better circulation. Get massages when you can, which also promotes circulation. And if you have to sit for long periods of time, such as at a desk for work, you want to get up often and stretch. When choosing what to wear, it does make a difference on how it will contribute to your swelling. So you want to make sure that you're wearing comfortable shoes, preferably like sneakers or something with a nice good tread, because high heels will actually contribute to swelling in your legs and your feet. You can get something called compression stockings, which are these stockings that have a certain amount of pressure to help encourage blood to return back to the heart, which reduces swelling. Make sure you're wearing loose clothes. Tight clothes can trap water in your hands and your feet and your legs, and that can end up causing increased swelling. And finally, we don't think about this a lot, but you also want to avoid tight jewelry on your wrists, your fingers, your feet, and your toes. So while swelling is normal during pregnancy, you cannot just ignore it because it can be a sign of a very serious condition called preeclampsia. Things to look out for that might be different from normal swelling is if the swelling comes on suddenly in your hands, your feet, and especially your face or around your eyes. If the swelling gets dramatically worse, like overnight, that's a huge warning sign. Also, if you're experiencing dizziness or blurred vision, or you get abdominal or stomach pain in the right upper quadrant, those are all medical emergency signs that you need to contact your healthcare provider immediately. If your swelling is associated with confusion or difficulty breathing, you need to go to the hospital. And finally, if you see swelling in one leg that's associated with a red area, you want to contact your healthcare provider immediately because this could be a sign of a clot called a DVT. I hope this video has helped you learn everything you need to know about swelling during your pregnancy and how to treat it. Please share your comments and let us know what topics you would like to hear more about. Remember to hit that like and subscribe button so you can get our latest content on pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.